today's video we will see about Parkinson disease. First one is definition. What is meant by Parkinson disease? It is a progressive neurological disorder which is characterized by muscular rigidity. Muscular rigidity is nothing but the stiffness of the muscle. There is no flexibility of the muscles. That is the first characterization. The second one is tremors. Tremor is nothing but the jerky movement similar to convulsion or fits. In colloquial word, you can say the second characteristics of Parkinson is tremors. Third one is hypokinesia. Kinesia means movement. Hypo means reduction in the body movement. Reduction in the movements. So these are the primary characteristic features of the Parkinson patients. So along with you are having other manifestation which is called the secondary manifestation. So the first category under secondary manifestation is gait. Gait, what is mean by gait? Gait is nothing but the changes or the way of the walking pattern of the particular, that is similar to the body language, we can say it is the walking pattern. So there is changes in the walking pattern. The second one in secondary manifestation is defective posture, unable to maintain their normal posture while walking or sitting. The third one is dementia. Dementia is loss of memory. And the last one is saloria. Saloria is nothing but increased in salivary secretion. So for the definition, you have to write all the primary and secondary manifestation of the disease. If they asked in 2 marks question or any exam, government exam or whatever it is, or for MCQ types, these are the characteristic features they used to ask repeatedly. Or the simple definition you can write for Parkinson disease is, it is the loss of pigmented dopaminergic neurons of substantia nigra. Okay, so in the central nervous system you are having so many neurotransmitters. The main neurotransmitter which is involved in Parkinson disease is dopamine, and the second one is acetylcholine. So dopaminergic neurons is nothing but the neurons which is responsible for the transmission or transfer of the excitatory dopamines in the central nervous system. So loss of pigmented dopaminergic neurons in the substantia nigra. Drug classification. Anti-Parkinson drugs. The first category is drug affecting dopaminergic system. Already we have seen the dopamine is involved in Parkinson disease. So dopaminergic neurons. The first category of drug is drugs affecting dopaminergic system. Under this you are having so many category of drugs. First, or the important drug or the prototype is dopamine precursor. So L-dopa or levodopa plus carbidopa combination. The dose of the combination is, drug combination is 25 mg of carbidopa and 200 mg of levodopa 2 to 3 times a day. So the commonly used drug for Parkinson disease is levodopa and carbidopa combination. The second category which is going to affect the dopamine level in the central nervous system is dopamine agonist. You know what is mean by agonist. Agonist will produce the action similar to that of the neurotransmitter which is producing the action. So dopaminergic agonist, similar to dopamine, it is exerting its action. And the drug first example of the drug is bromocriptine. The second one is pramipexole, and the respective dose of bromocriptine is 3.75 to 4 mg. So it is also 2 to 3 times a day. Okay, so daily pramipexole and the dose is 1.5 to 4.5 mg. The third one is peripheral decarboxylase inhibitor. So when you are taking the drugs, so it is not only entering into the central nervous system, so it is the drug via bloodstream, it is circulated throughout the body. So in the peripheral nervous system or in the whole body we can central and peripheral compartments. For example, in Parkinson disease, the drug also reaches or circulated in the peripheral nervous system. So in the peripheral thing, you are having decarboxylase enzyme which is responsible for the metabolism of dopamine. So how to inhibit or how to block the particular enzyme to increase the level of dopamine in the so how to increase the level of dopamine. Okay, so carbidopa 200 mg and benzarizide. So peripheral decarboxylase inhibitor. The peripheral decarboxylase inhibitor. The next category of drug is MAOB inhibitor, monoamino oxidase inhibitor. Okay, so in the synaptic vesicle, that is within the neurons or in the presynaptic neurons, the dopamine is stored and it is released. Okay, so metabolizing enzyme for the dopamine is carboxylase, that is peripheral decarboxylase enzyme, and other enzyme which is responsible for its metabolite is monoamino oxidase B and catechol O methyl transferase. These are the enzymes in the synaptic cleft you will be having. So how to inhibit both the enzyme? So MAO inhibitor, the important drug is, or the commonly prescribed drug is seleginide. Dose is 10 mg per day. COMT, catechol O methyl transferase inhibitor, and the drug is entacapone, tolcapone, and the dose for entacapone is 600 to 2000 mg per day, tolcapone 200 to 600 mg per day.